were never using the website.
They don't follow our
They don't follow
recommendations.
recommendations. It's not a problem.
Only the migrants
Only
are
the
getting
migrants are
infected.
getting
The
infected.
community
The
is
community
not
is not concerned.
Did any of these
Any of these statements make you uncomfortable?
Did they make you cringe
Did
a
they
little?
make you cringe a little or a lot?
These are statements
These
I have
are
heard
statements I
throughout
have
the
heard through the
COVID-19
COVID-19 pandemic response
here in Utah.
here in Utah.
But this mindset isn't
But this man is saying in
when
Utah.
COVID-19 was first
When
identified in the
COVID-19
United
was
States,
first identified in the
national
United
leaders were
States,
calling it
national
the
leaders
Chinese
were calling
virus.
it the Chinese
And
virus.
Asian American
And Asian
communities
American
across the country
communities
experienced
across
racist
the country
attacks.
experienced racist
And
attacks.
as COVID-19
And as
has spread,
COVID-19 has
we have
spread,
seen worse health
we have
outcomes
seen
in
worse
already
health
marginalized
outcomes
communities.
in already marginalized
American
communities.
Indians and Alaskan
American
natives
Indians and
are
Alaskan natives
3.5
are
times
30.5
more likely to be
times
infected with
more likely to be
COVID-19
infected
than
with
white
COVID-19
populations.
than white populations.
Black and Hispanic populations
Black and Hispanic
are
populations are
twice
twice
as
as likely to die from COVID-19 as white populations.
Globally,
This pandemic is closing the
gap
gap between the wealthy and the poor nations. This is a health crisis, but it's not only a health crisis. The World Bank warns that this virus could push between 40 and 60 million people into extreme poverty this year, with Sub-Sahara and Africa. And so Asia hardest hit.
At the beginning of this
But
pandemic,
at the beginning of
we
this
were all
pandemic,
susceptible.
we're all
There was no
susceptible.
treatment,
There
no
was no
vaccine,
treatment,
no one
no
was immune.
vaccine, no one
We were all
was
equals.
immune. We were
And the
all
ways to
equals.
protect
And
yourself
the
from
ways to
COVID-19 are
protect
pretty
yourself
simple.
from COVID-19
Right? Stay
are
6
pretty
feet away from
simple.
others, wear a
Like
face
stay
covering,
6
wash
feet
your
away
hands.
from others.
So
Wear a face
why
covering,
then
wash
does
your
the risk of
hands.
being
So
impacted
why?
by
Don't does,
COVID-19
don't does the
depend
risk
on
of
skin
being
color,
impacted by
the language you
COVID-19
speak,
depend on the
where
skin
you
color,
live, or where you
speak,
work?
where you live or where you work.
Let's think of life before
Let's think of life
COVID-19.
before COVID-19.
I've got a couple
I've
scenarios
got
for you, and I'm sure
a
most of
couple
you can relate to at least one of them.
scenarios for you. I'm sorry, most of
My
you
husband and I
can.
both work full-time. We have
My
2
husband
young
and
children and no
I both
family
work
around,
full-time.
so we rely on school and childcare to make our lives functional. There have been times
There have
more
been
than I will
times
admit
more
on
than
this
I will
stage
admit on this
where
stage.
one of my sons would feel sick at night.
Where one of my
Morning,
sons
he'd
would
seem
feel
okay.
sick at night.
Just
In
slip
the
him a little
morning he'd seem okay.
acetaminophen
Just
and head
sleep
him off to
him a little
school and
septimone
hope that the
and
school
head
would call
him
me in
off
a
to
few
school and
hours to
hope
come pick
that
him
the
up.
school will call me
Maybe a more
in a
common
few
scenario.
months to come pick them
You
up.
wake up with a
Maybe
mild
a more
cough.
common
You're feeling a
scenario.
little tired, but you have several important meetings that day. You take some cold
You
medicine,
take some
head
cold
into the office
medicine,
and go
head
about your
into the
regular
office
routine.
and go about your
Falling behind
regular
for
routine.
something so
Falling
mild just
behind
isn't
for
worth
something
it.
so mild just isn't worth it.
Now,
Worth
during
it.
COVID-19,
No,
these two
during
scenarios are
during
completely different.
COVID-19, these two scenarios
There's
are
no way I'm
completely
sending my kid to
different.
school or
There's
going
no
into
way I'm
work if
sending my
any
kid
of
to
us are
school or
symptomatic at
going to
all.
work
I
if
don't want to
any
risk
of
spreading
you are
COVID-19 to anyone.
want to risk
Plus,
spread
I have plenty of
COVID-19
paid
to
sick leave
any,
if I need
plus
to
I have
take time
plenty
off,
of paid
or I
sick
can work from
leave.
home if I feel well
I
enough to
need to
do
take
so.
time off or I can work
The
off
risks
home.
of sending my kid to
I
school or
feel
going
well
into the
know
office
the risk of
outweigh the
sending my
benefits.
kid going to the office
Now,
outweigh
another
the
scenario. Probably one
benefits.
unfamiliar to
No.
most of you.
Another scenario, probably one
Imagine
unfamiliar to
you
most of you.
are a
Imagine
27-year-old
you
refugee from Somalia.
are at 27
You live in a
years
small
old
apartment
from
with your
Somalia.
extended
You live in
family.
a small apartment with
You
your
came to
extended
Utah 8 months
family.
ago
You came to
after spending
Utah
5
8 months
years in a
ago
refugee
after
camp in Kenya.
spending 5 years in
In
refugee
order to become
camp
quickly
in Kenya.
self-sufficient,
In order
you
to
take a job
become
at a
quickly
meatpacking plant.
self-sufficient, you take a
There,
job at
you spend 8
meatpacking
hours a
plant.
day, shoulder
There you
to
spend
shoulder
8
with your
shoulder to
coworkers.
shoulder with your
You get paid by the
coworkers.
hour. You don't
You
have any
get paid
sick
by
leave
their,
and obviously no way to work
or
from
you don't
home.
have any sick leave,
You know, you've
and
heard of
obviously no way
COVID-19
to
and
work
that
from
young people
home. You
typically
know,
don't
you
get that
heard
sick.
of COVID-19 that you
So
people.
when you wake up with a sore throat one morning,
So when you wake,
what do? Do you stay home?
what do you
Miss
do?
8 hours
Do
of
you stay
income
home,
and
miss
have to
8
worry
hours
about
of income,
how to
and
pay for
have to
groceries
worry
next week?
about how to pay
Or do you go into
groceries
work
next
with
week,
that sore
or
throat?
do you going to work with
I
that
bet you
sore
go into work.
throat?
In that situation, in that moment,
In that
the
situation, in that
benefits of
moment,
going into
the
work
benefits of
while
going
you're
to
sick
work
outweigh
when
the
you're
risks.
sick outweigh.
You know, protecting yourself and your family from COVID-19 is definitely easier if you have higher socioeconomic status. Anyone who tests positive for COVID-19 is asked to stay home, away from others, for at least 10 days. And they have to give the names and information of all of their close contacts to the government. This is so the government can tell their contacts that they too have to stay home away from others.
And they stay home away.
If any sick
from
individual
other stuff.
lives in a household with other people,
Any sick
we ask
individual
them
lives
to use their own
household
bedroom
with
and
other
their own
people, we
bathroom.
ask them to use their
When
own
public
bedroom
health
and
can't
their own
identify how
bathroom.
individuals are getting
When public
infected,
health can
that
identify
means we
now
have community
individuals are
spread,
getting infected,
and all
that means we
individuals
have
are asked
community
to stay
spread and
home in order
individuals
to
are
stay
asked
safe.
to stay home in order to
That
stay
works
safe.
well for people with big
That
houses,
works
or those of us who can work from
for
home.
people with big houses or
But
those
what about
of
the rest of our
us who can
communities?
work. But what about the
It's
rest
no
of
surprise that our
communities?
hotspots of COVID-19
It's not
in Utah
surprising
have
or
occurred in
hot
tourist town apartment
COVID-19 in
complexes
Utah have
where workers in
occurred
the
in
service
tourist
industry live,
apartment complex where
and
workers
in
in the
communities
service
where health and
industry
economic
live, and
disparities have been
communities where
prevalent for
health and
years.
economic disparities
This
have been
virus has shown
prevalent
us
for
that
years.
while we are
This
all
virus has
clinically
shown is that
susceptible, the
we
disparities
are
ingrained
clinically
in our
susceptible.
society
The
have
disparities
allowed
ingrained
specific
in our society
populations to
have
bear
allowed
the biggest
specific
burden.
populations to bear the
You
biggest
know,
burden.
COVID-19 came to Utah initially
COVID-19 came to Utah
from people who were
initially
infected while they
from
were on
people who were
international
infected
cruises,
while
and
they
from
were
tourists
on
who were in
international
town on
cruises
ski
and from tourists
vacations.
who were into
And for a
town
while,
on
we
ski
had no secondary
vacations.
cases.
And for a while,
All
we
of our
had
cases and their contacts
cases.
were able to stay
And all
isolated.
of our cases.
We were patting ourselves on our backs. But then, on March 4th, we had our first instance of community spread.
We had
A
our
worker at a
first
local
instance of
restaurant,
community spread.
likely infected by someone in town on
Worked at a
vacation.
local restaurant likely infected by
And from
someone
there,
on
more
town
community
vacation.
spread was
And from there,
identified,
more community spread
changing the
was
demographics of our cases
identified.
quickly.
Changing
On May 27th,
demographics quickly.
the number
On May
of Hispanic
25,
individuals in
27th,
Utah infected with COVID-19
individuals in Utah
surpassed
infected
that
with
of white
COVID-19
individuals.
surpassed that
And
of
for
the
the next several
white
months,
individuals.
the burden of disease
And for the
continued
next
to
several
shift
months, the
away from
burden
white
of disease continued to
populations
shift
and
away
toward
from
persons of
white
color.
populations toward
You know,
persons of color.
even though
Even
Hispanic
though
individuals
Hispanic
only
individuals only
make
make
up
up
14% of Utah's population,
14
at its
Utah
peak,
population at
they
its
made
peak,
up nearly
they made up
50%
nearly
of our COVID-19
50% of our
cases.
COVID-19 cases.
While the Utah
While
majority
the Utah
was physical
majority was
distancing and
physical
staying home,
distancing and
the
staying
Utah
home,
minority was
the
working in
Utah
essential
minority was
jobs.
working in
They were
essential
producing our
jobs.
food,
They were
keeping
producing
our
our
lights
food,
on,
keeping our
and
lights
keeping our
on,
water
and keeping
clean.
our water clean.
They were putting
They were
themselves and their
putting
families at risk
themselves
for
and
being
their families
infected
at
with
risk for being
COVID-19
infected
every
with COVID-19
day.
every day.
I-15 is an interstate
I-15
that
is an
separates Salt Lake
interest to
County
separate
into a
Salt
west
Lake Country
and an east
into a
side.
west and east side.
Communities west of
Communities
I-15
west
tend to
of
have lower
I-15
education,
tend to have
less
lower
income,
education, less income,
higher rates of
higher
racial and
rates
ethnic
of
groups,
racial and
and more
ethnic
individuals
groups,
living in
and
one
more individuals
household
living in one
than the east
household
side.
than the east side.
If you live
If
west
you
of
live
I-15,
west of
you're
I-15,
twice as
you're
likely to
twice
be infected with
likely to be
COVID-19
infected
than
with
if you live east.
COVID-19 than if you live
But
east. But
we know the virus
we
can't
know
see
the virus
socioeconomic
can see
status.
socioeconomic status.
The virus doesn't
The
know the
virus
skin
doesn't know
color
the
or
skin
language
color or
spoken by its
language
host.
spoken.
It can be
But
the great
it also
equalizer.
can be great, the great
We saw
equalizer.
COVID-19 spread
We
like a
saw
wildfire through a refugee
COVID-19 spread
community in
like a
northern
wildfire
Utah,
through
and then into surrounding
refugee in
communities
northern
of a
Utah,
variety
and then into
of races,
surrounding a variety
ethnicities,
of
languages
races,
spoken, and
ethnicities,
incomes.
languages spoken, and
This
incomes.
pandemic has taught
This
us
pandemic
that
has
we are
taught
all
us that we are all
interconnected.
interconnected.
I know so many of us
I know
want to erase
so
this
many of
pandemic
you
experience from our memories.
towards
It
this
has
pandemic
been
experience
painful.
for our memories, from
Health
our
disparities
memories.
hurt us all.
It has been painful,
The
health
virus doesn't
disparities
stop at
hurt us
neighborhood
all.
borders.
The virus doesn't stop
This
at
pandemic has
neighborhood
also
borders.
highlighted the
This pandemic has
interdependence of our
also
physical
highlighted
and
the
economic security.
interdependencies of recycle and
When one
economic
community
security.
suffers,
When
we
one
are
community
all
suffers,
more
we
vulnerable.
are all more
But
vulnerable.
it does
But
not
it
have to be
doesn't
this
have
way.
to be this way.
As Winston Churchill is credited as
As
saying,
Winston Churchill
never
is
let a good
credited as
crisis go
saying
to
never.
waste.
Let a good
So I
crisis go
urge
to
each one
waste.
of
So
us to
I
use
urge
this
each
pandemic
one
as a
of us to
catalyst
use this pandemic
to
as a
effectively address
catalyst
the health
to effectively
disparities
address
that
the
have been
health
fracturing our society for
disparities
decades,
they
yet
have been
magnified
our
by
society for
COVID-19.
decades, yet magnified by
Each one of us has
COVID-19.
a powerful
Each one of
voice,
us has a
and we
powerful
must
voice,
use that
and we
voice to
must use
strengthen
that voice
those
to strengthen
society has
whole
ignored.
society has ignored.
You are
You
part of
are
the
a part,
solution.
or you are
Let's
part of the
create security
solution.
now
Let's create
throughout our
security now.
communities so that we are
Show for
all
communities so
safer in
that
the
we are
next
all
crisis.
safer in the next
And let's
crisis.
do that
And
by
let's do
fighting
that
for
by
living
fighting
wages,
for living
to
wages,
support physical and
wages,
economic
to
security,
support psycho and economic
paid sick leave,
security,
so that no one has to choose
paid
between
sick leave
staying home when
so
they're sick
that
or putting food on the
table,
affordable housing,
to
ensure that
all of communities are safe environments where people can thrive, and access to quality health, allowing individuals to focus on disease, prevention, and general wellness. Because the health of each of us depends
on the health
on the health of all of